the provider voice is probably as important, or probably more important than the patient voice in these state conversations. For providers to say, like, my patient needs access to this testing, to biomarker testing, would really make a big difference.
That was Kristen Santiago, the Senior Director of Public Policy Initiatives for Longevity Foundation. She'll be back later in the show. Welcome to Cancer Buzz. I'm your host, Summer Johnson. On this show, we frequently examine the advantages of precision medicine for patients with cancer. An integral part to precision medicine is biomarker identification through testing, but not all patients have access. Some groups are working to push policy at the state and federal level that will broaden access and get those patients the testing and treatments they need. We spoke about these advocacy efforts with Kristen Santiago, the Senior Director of Public Policy Initiatives for Longevity Foundation.
So I oversee Longevity Foundation's public policy initiatives. So that can range from work with the FDA to work with people on the Hill to really kind of identifying gaps in access to care and finding those policy solutions that can help increase access to optimal care.
Kristen, walk us through biomarker testing and why it's so important for lung cancer specifically.
So lung cancer is really at the kind of forefront in precision medicine, and lung cancer patients have been able to really benefit from the advancements that have been made in precision medicine, mostly related to access to biomarker testing. So right now, for a majority of lung cancer patients, they can go and have their tumor tested to see what type of lung cancer they have, which can then identify what therapies will work, also what therapies won't work, which is really important, as well as which clinical trials they might be appropriate for them. So it really can help drive patients to the most optimal, beneficial treatment plans available.
And we're starting to see some evidence that shows treatment with targeted therapies in some instances have better clinical outcomes when compared to chemotherapy, right?
Absolutely. And I would say that the outcomes and the survival rates are better than chemo for some patients who have known biomarkers where there are appropriate therapies. But also, if you think about not putting people on treatments, chemo or whatever, without knowing whether or not they'll work, patients are not having to go through suffering from side effects. And also you can layer in costs to the system of paying for therapies that won't work. And if you don't do the biomarker testing, you may not know that. So it's really revolutionary, for the patient's outcomes and fewer side effects, et cetera. It's like a no-brainer. Like all appropriate lung cancer patients based on guidelines should have this testing.
So it's a no-brainer that all patients should have access to it, but they don't. Why is that the case for patients with lung cancer specifically?
So there's a few reasons. One is depending on an individual's insurance, whether or not their insurance covers it, whether or not there's prior authorization, other hurdles that people have to jump through is a big issue, which we focus on from a policy perspective. There's also an uneven kind of lack of awareness across the country. Doctors who specialize in lung cancer are more aware of the current literature and research, et cetera, and are more likely, to test their patients for biomarker testing. But then there's, general oncologists who may not have access or time to stay up to date and may not necessarily test their patients or have access to biomarker testing.
What about the patients? Are we having any challenges with their general knowledge and comfortability with the testing?
So I think there's also concerns from the patient perspective where they just want to get treated right away. So they want to rush to the first available treatment rather than waiting for the results of their biomarker testing, or they don't want to take the time to do the testing. So there's kind of many issues. And there's, from the patient perspective, a total lack of awareness. But it's not their job to know that they should ask for biomarker testing, but we're trying to empower patients. It's a complex problem, but one that I think that we can collectively fix.
So your job is to push for that coverage that will help remedy some of these inequities to access for testing. Why do you think that advocacy in support of coverage for biomarker testing is really needed at the state level?
So I'll start and say there's a huge lack of understanding and awareness about precision medicine and biomarker testing. It's kind of like a complicated topic. It's a new topic. It's one that policymakers really, it's not on their radar at all. So starting with raising awareness about why this technology is so important to care is a big step. And then secondly, once you explain kind of what delays mean in care and so if you're looking at prior authorization, if you are delaying a test for, 2 weeks or 2 days, that still delays when someone can start the most appropriate treatment. If someone doesn't have coverage for testing, their outcomes will be completely different. There are specific types of lung cancer where there are, targeted therapies that work very well. My aunt is alive today with lung cancer because she's on a targeted therapy and she had biomarker testing. But if you skip that step and just throw someone on chemo or some other immunotherapy just as like a Hail Mary pass, it can really affect their outcomes in a negative way.
Let's talk about the states. How do you think they stack up in terms of awareness of this issue in the state legislatures? And then how are groups advocating for that payer coverage?
So in March of 2020, we released a report, and you can find it on lungcancerscore.org, that looked at a few different components specific to lung cancer and looking at the Medicaid population because we were trying to understand kind of inequitable access, given that most Medicare patients have access to biomarker testing. And so that has kind of started to drive our state level work. Around 2/3 of the states do not cover in Medicaid comprehensive biomarker testing. Again, looking at lung cancer, but if they're not covering it in lung cancer, they're probably not covering it in other disease states.
Insurance coverage obviously isn't the only step toward making precision medicine more equitable for all. There are other challenges. For instance, the disparities in capacity for testing between academic and community centers. Can you talk about what Longevity is doing for advocacy on those issues and in patient education, since you're a patient-facing organization?
Part of what we do is trying to understand and research what the issues are, where there are opportunities. So we have a whole patient-focused research center that helps to better understand that. And from our findings, that helps guide our policy and our education services for patients. We have on our website a ton of resources for patients and caregivers. We are partnering with ACCC on a study. My colleague Nikki Martin is running it, but to understand kind of where the disparities in testing are. And we're doing the patient side and ACCC is doing the provider side. So pulling those two findings together to see where there are gaps in care, which is not shocking, the preliminary findings, but it's really sad, I would say. So from there, we try and look at what the policy solutions might be to make it more equitable. We hold like meetups virtual currently on Facebook or Zoom for patients and caregivers to come together and talk about their experiences. And they really learn from each other and can help navigate the system, which is wonderful, but we're also still not getting to everyone. So we're just hitting those more kind of engaged patient population, I would say.
Kristen, what do we want to leave here for the cancer care team? How can they stay up to date and how can they get involved in advocacy in their own areas?
So I think for the individual provider, keeping up to date with the guidelines is obviously very important because I think NCCN does a really good job staying up to date as far as biomarker testing, at least for lung cancer. I would work with your state association. So the state ASCO associations, I think, would be a good place to go. I know ACS CAN is working more from the patient advocacy side, but is pulling together a lot of groups who are really passionate about this topic. We are helpful to be a resource if we can, but I think the provider voice is probably as important probably more important than the patient voice in these state conversations, for providers to say, like, my patient needs access to this testing, to biomarker testing, would really make a big difference. So getting engaged, being open to be, a spokesperson and a partner in these conversations would be really, really helpful, because biomarker testing saves lives. We work with many patients who are alive today, literally because of biomarker testing. So whatever we can do to make sure that all patients, regardless of where you live and insurance status, have access together, we can work together and make that happen.
Longevity isn't the only organization that's working for change. Hilary Gee Goeckner leads the state advocacy campaign efforts for the American Cancer Society Cancer Action Network. Here's our conversation.
So I support our staff in all 50 states and the territories working on a couple of different issues, including biomarker testing, clinical trials, and Medicaid. So we have staff and volunteers on the ground in every state capital, leading public policy campaigns to improve access to care for cancer treatment, but also cancer prevention.
Hilary, biomarker testing for patients with cancer is incredibly uneven. Can you walk us through some of those factors that impede equitable access to testing?
So biomarker testing is becoming increasingly important in cancer care, allowing doctors to target therapies based on mutations and markers in an individual cancer patient's cancer. And so that allows them to avoid the more generalized treatments like radiation and chemotherapy that can have really devastating side effects. The challenge is not everyone is benefiting from the latest advances in cancer treatment. So there are a number of issues that impact a person's access to biomarker testing. Patient awareness, providers being up to date with the latest treatment recommendations, facility capabilities. But one big opportunity that can be impacted with state level policy change is insurance coverage of biomarker testing. Varies a lot, insurance plan to insurance plan, and also based on an individual patient's characteristics, whether or not their insurance will cover biomarker testing that might be recommended by treatment guidelines and their individual physician. So there's a huge opportunity to make sure all patients who can benefit from biomarker testing have the insurance coverage for that testing so that they aren't forced to pay out of pocket or forego it altogether.
Does the overall confusion about insurance coverage for biomarker testing impede the ability to make sure every patient has access to it?
So it's definitely a challenge, and not every patient who has cancer needs to get biomarker testing. That really depends on the treatment guidelines and kind of what the research is showing and what treatments might be available for that patient. So we're not advocating that every single cancer patient get biomarker testing at this point. It's becoming increasingly important, and it's standard of care for some patients. But if the insurance plan that patient has won't cover it, then most patients, or a lot of patients, I should say, are not in a position to pay out of pocket for that testing. And certainly providers might have a assumption or a feeling or experience with a particular insurance plan and say, I know that this isn't going to get covered, and the most important thing is just to get this patient on some treatment. So certainly providers worrying that insurance won't cover the biomarker testing is a challenge. And when this policy is in place and when insurance plans are required to cover biomarker testing, when it's supported by medical and scientific evidence for their patients, then that's one less question for providers to worry about.
Why is advocacy on the state and federal level so important?
There are opportunities at both the state and federal level to impact this issue. Our focus right now is on the state level because there's a lot more opportunity for impact. And having a lot of state activity on an issue can help build momentum and make the case for federal action. But, there isn't a whole lot happening at the federal level in a lot of areas right now. We've seen a lot of stalemate and inaction. But at the state level, there are huge opportunities for patients and providers to make their voices heard and really impact patient access on issues like biomarker testing.
Can you tell us about some of those bills in state legislatures that were successful this year?
So this year in 2021, we saw two big wins on insurance coverage of comprehensive biomarker testing in both Illinois and Louisiana. Bills were passed with unanimous support from every member of both parties, which is unexpected and exciting because this has such a huge impact on patients. So those laws both take effect January 1 of 2022. And we're anticipating a lot of discussion in other states next year as well as sessions come back, looking at expanding coverage of biomarker testing through both private insurance plans that are regulated at the state level, as well as state Medicaid programs.
What was really encouraging to you about these state campaigns?
So in Illinois this year, we had a really great win with kind of first in the nation coverage of biomarker testing with the support of a really great coalition and engagement from patients who benefited from biomarker testing, but also oncologists and other healthcare professionals who have seen the benefits of targeted therapies and biomarker-driven treatments in the patients that they care for. And the legislature just got really excited about the opportunities of kind of expanding access to biomarker testing. The legislation sailed through, and it's a really exciting model for other states. And we anticipate several other states will be looking at similar legislation in 2022.
What about the cancer care professionals? Did they get involved in these efforts at the state legislatures?
So Dr. Sheetal Kircher from the University of Chicago Cancer Center got involved in our campaign and testified in committee. And she also connected us with a patient who is herself an oncology nurse who shared her story many times with lawmakers. And that's so valuable. And it's great to hear Dr. Kircher talk about how exciting it is to be able to connect patients with advocacy opportunities. So Dr. Kircher connected us with one of her patients, Alicia Mandel, who shared her story about benefiting from biomarker testing and also talked about how exciting it is to be able to give patients those opportunities to use their stories to educate lawmakers and change kind of opportunities for other patients in the future. And so that's another great way that providers can help with advocacy campaigns, is identifying those patient stories and either, sharing those on their behalf, or even better is connecting those patients with organizations like ACS CAN that can give them a platform to share their experience.
Hilary, how is your group communicating with cancer care professionals? How can they get involved?
So that's a great question. Healthcare providers and cancer care providers have a huge opportunity to inform state policymakers and help shape the decisions that are happening in state houses across the country. So a lot of state lawmakers are working part-time as legislators. They might be teachers or farmers or lawyers in their day jobs and spend, a few months out of the year also working in the state legislature. And so in most states, they don't necessarily have a deep background in a lot of the issues that they're working on, and certainly in something as niche as biomarker testing for cancer treatment. So it's so important for advocates and healthcare professionals especially to share their experiences and help elevate the stories of their patients and the people that they see in clinic every day. So the best thing that folks can do is get connected with ACS CAN staff in their state, and I'm happy to help make those introductions. You can go to fightcancer.org and find your state as well. But we are running campaigns in every state, and we have lots of volunteer opportunities, and love to get connected with healthcare professionals so you can get hooked into what's happening in your state on biomarker testing or other issues as well.
ACCC and the oncology community are examining health equity issues right now. Why is access to biomarker testing so important?
So for ACS CAN, it's particularly important that we look at the insurance coverage of biomarker testing so that we are addressing health disparities and working to advance health equity. Not all communities are benefiting from the latest advances in biomarker testing and precision medicine. And unfortunately, because there are already such big disparities in cancer outcomes based on race and income and geography, if we don't take action to expand coverage of biomarker testing, we could actually see those disparities increase, because you'll have people who might have the means to pay out of pocket for that biomarker testing, or are more likely to go to an academic medical center where the testing might be covered, or have better insurance to begin with that covers the biomarker testing. So if we don't take policy action like expanding coverage of biomarker testing, those disparities that are already unacceptable could become even larger as cancer treatment becomes more and more precise.
Thank you to our guests, Kristen and Hilary. Down in the show notes, you can find links to resources about these advocacy efforts and how to get involved yourself. We rely on reviews and feedback, so if you're enjoying the show, we hope you will take a minute to leave us a review and share the episode with a colleague. This allows us to continue to provide you with the latest news and resources in cancer care. Until next time, for the entire Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.